Rob, thanks. Spectrum Health is hosting an event focusing on preventing heart problems after cancer treatment.
The event, of course, comes just in time for American Heart Month, and there is still time for you to sign up. So joining us to talk more about why this is so important, we have cardiologist Laura Franey. Thanks so much for being here.
Thank you so much for having me.
Obviously a big month, and obviously in your profession, you're always aware of cardiovascular health. And
right.
Let's first talk about that and how prevalent is it in women compared to men and some of the signs and things.
Sure. So I think traditionally heart issues have been considered a men's problem, but it's certainly very prevalent among women. And this is typically after menopause, but can affect younger women as well. So it's certainly a large issue that we want to keep creating awareness for.
What do you think is one of the most surprising things, I think especially for women, you know, after they come to you and start learning more about this, that you hear? Is it just, I had no idea this is something that, you know, could affect me?
I think so, and I think especially for women, they may not present with those typical symptoms that you hear about, that crushing chest pain when you're doing some type of exercise. Their symptoms can be very vague, fatigue, shortness of breath, you know, things that you might not think about. So they often are surprised to learn they have a heart issue.
Okay.
So let's talk about the event and talking about after a cancer issue. How do you deal with that, and what kind of things are you asking? What kind of questions should they be asking?
Sure, so that's a great question. You know, I think that the good news is cancer patients are surviving now, which is excellent, but that does come with long-term risks. Depending on the type of cancer therapies they received, specific cancer therapies can actually affect the heart. So we want to know what type of chemotherapy they received, if they received radiation to the chest, because these therapies can have long-term effects on heart health down the road.
Okay, so you have that event coming up.
Right.
So can anyone come out to that? Do they need to sign up? To kind of talk about those details.
Sure, so it's a public event. It's this Wednesday, the 19th, from 5 to 7:30 at Frederick Meyer Gardens. It's open to the public. Registration is free, so we definitely encourage everyone to attend.
Very good. And you're going to hang around with us, right? So we can talk a bit more in the next hour.
Absolutely.
Perfect.
Very
All right,
good.
thanks so much.